Hi.
Hi, my name is Jacinda, and I'll be the PA student working with you today. Can I have you confirm your name and your age, please?
Yes, it's Catherine, and I'm 35.
All right, okay. And what is your preferred spoken language?
English.
Okay, perfect. So I really want to get to know you a little better during this time, and I'm here to listen and help with you about anything. So feel free to just answer honestly, because this is a safe space, okay?
Okay.
So what brings you in today?
Well, so I keep having these episodes where I'll just be out doing something and my heart starts racing out of nowhere, and I feel like I can't catch my breath, almost like I'm drowning, and I feel like I'm gonna die every time.
Okay. And when was the first episode?
The first one was, I think, about 4.5 months ago. And then I was actually just out at a grocery store and it happened to me, and I was so embarrassed. The second one, I was at home. And then the last one was actually yesterday, and I was in the car with my husband driving to, I own a clothing store, and we were driving there, and I had to have him take me back home.
Oh, I'm sorry. That sounds scary. So when did the last two episodes occur then, if the first one was 4.5 months ago?
The second one, when I was home, maybe I think like a month ago. And then the other one was just yesterday. It was yesterday morning.
Okay. And do you think there was anything that provoked any of these episodes?
Not that I can think of. I mean, the first one was just at the grocery store. I always go grocery shopping. The other one I was just at home. Like I don't think I was doing anything. I was answering some emails for work. And then yesterday, like I said, I was on my way to work. But I wasn't driving, thankfully.
Yeah, that's good. So during these times, do you think there was anything, like a major event that happened in your life beforehand that could have possibly like caused you to feel this way?
Not that I can, particularly think of. I mean, work has been pretty stressful with COVID. Obviously, my store's been closed. Try to transfer things online so I could still sell clothes and stuff, but it's just been really stressful. I mean, so that's kind of like the only thing I can think of.
Yeah, and it's good you have your husband help you out with that too.
Yeah, he's very helpful.
And I know that you said you had some like shortness of breath and you felt like you were drowning and your heart was racing. Was there anything else you felt along with those symptoms during that
I got
time?
like so sweaty. I felt my heart would race first, and I was like, oh no, what's happening? And then I'd kind of break out into sweat all over.
Oh, okay. And how long would these episodes last?
They've all been maybe like 4 or 5 minutes, even though it feels like forever.
Okay. And is there anything that you find helps you when you're in those episodes? Like anything that helps you get out of it or helps you feel a little better?
No, I mean, I've just kind of waited to see what would happen. The first one, I thought I was having a heart attack, and I was like, no, I'm too young. I'm only 35. So they've just kind of passed on their own.
Okay, that's good. And do you happen to have any history of like anxiety or depression or any other?
Me personally, no.
Any family history of similar?
Well, my mom was diagnosed with depression maybe like 5 years ago. We don't really know like what caused it for her. She didn't want to tell anyone at first, but she was just really down and on the outs. So my dad and I told her she should go talk to somebody.
And how do you think that's affecting you? Has that impacted you in any way, taking care of her mom or just seeing her?
Not really. I mean, she, they put her on some kind of medication, and her mood's definitely improved a lot. And so I think now it's fine. Like it hasn't. Yeah,
that's good. Yeah. And for you and your own like little episodes of fear, on a scale of 1 to 10, how would you rate like the fear that you feel, with 10 being the worst?
Yeah, like a 10.
10?
Yeah, I think I'm gonna die. It's so scary.
That does sound very scary. And so you said prior to 4.5 months ago, this never happened before? Nothing? And I'm just gonna ask you a little bit more about your like symptoms and some other questions. Okay. And how does your sleep pattern look like currently?
About the same. I think because of work, I find it like I'm staying up later, just trying to work on stuff from home so much. But I mean, I still try to get like 6-7 hours of sleep.
Okay. And is that like normal for you?
Yeah,
Normal
it's
sleep?
always kind of been the same.
And do you find that your appetite has been affected during this time?
No, maybe a little bit, like decreased.
Mhm.
I've been skipping breakfast, and for lunch, I've like only been like snacking more, but I still, I'm still eating.
Okay.
Yeah.
Good. And have you noticed any changes in your weight because of your like decreased appetite?
No, not really.
And I know that you said like during these episodes you just feel like everything you're sort of drowning and you're about to die. I know that that must be really scary. So does this really impact you like on a day-to-day basis? Do you find yourself like thinking about it or worrying about it a lot?
Yeah, I mean, after the first one, I was definitely worried it would happen again, but I kind of almost forgot about it, and that's why I didn't go to someone right away. And then when the second one happened, I feel like ever since that one, like a month ago, I just constantly think about it. And yesterday is actually the first time I was leaving the house in a long time, and then that happened, and I'm kind of worried to go out and have it happen again.
Yeah.
I don't want to be embarrassed in the store, and it's a whole ordeal now.
Yeah, I can only imagine. And that's why you're here, and we're here to help you, okay? And I know you said that your sleep is like about the same, and then on a normal basis, do you find that your thoughts are like racing? Like you're thinking about a lot, or
I mean, thinking a lot about work, yes. I feel like maybe I'm kind of jumping from one thing and the next, kind of thinking, okay, what do I have to do? But that's about it.
Okay, so it doesn't seem like your thoughts are like all over the place anytime.
No.
And do you find that you've been having more risky behavior, or have others told you that you seem to be behaving like differently than usual?
No. I mean, I'm not going out. I'm obviously with COVID, but my husband wanted to go out to dinner, and I just don't even want to try and have this happen again. So I've really been holding up in the house.
Yeah, I'm sure that must be like something that you're always thinking about and that's on your mind. I know that since you're cooped up at home, do you find yourself like spending more money than usual, or has anyone, your husband, told you seem to be spending too excessively or anything like that?
I don't think too excessively. I was definitely online shopping in the beginning quite a bit, but it's kind of slowed down now. I think.
That's something I've been doing too. And on a normal basis, do you ever feel like you hear any voices?
No.
Do you ever feel like you see anything that's unusual that shouldn't be there?
Mm-mm.
Does it seem like other people ever comment on your behavior, like your family or your husband notice anything off?
No.
Have you been having any unusual feelings on your like body or skin, like feels like something's touching you all the time or anything like that?
No.
Okay. And then have you been experiencing any unpleasant smells that others don't notice, or any tastes?
No.
And I understand that COVID right now is causing a lot of stress on you and your family and your business. Has there been any other stressors in your life that you'd like to talk about?
It's kind of hard to talk about. My husband and I have been trying to get pregnant.
Okay.
And it's been like a year and a half. It's just not working. So probably I think our next steps talk to somebody, like a fertility specialist.
Yeah.
But that has been pretty stressful.
Okay, I see. Yeah, I can definitely like connect you with someone here. We have a lot of experts who could probably help you.
Okay.
And they can just give you some guidance with that, okay?
Okay.
And on top of that, has there been anything else that's been bothering you?
No.
No? Okay. Yeah, I know it must be a really hard time right now with everything going on and everything, so we're going to take good care of you here, okay? Okay. And this is just something I ask everyone, but do you ever have any thoughts of harming yourself?
No.
Any thoughts of harming others?
No.
Have you ever tried to harm yourself in the past?
No.
Okay. And with your work and you said you're currently employed. Are you currently doing anything else on the side, like any other jobs or like any education that you're pursuing?
No, just my store. I did feel bad. I had to lay off a couple employees. But yeah, I'm just trying to work from home as much as I can.
And would you say, like, I know you said that it's been a bit of a transition with your store, but how has that been going? Can you tell me a little bit more about that?
It was, I think, in the beginning hard because for the first couple months, we didn't have an online store, so we had no, at least on my side, no income. Thankfully, my husband still can work from home easily, but half the income was gone.
Yeah.
But we're getting some sales, so it's
That's
okay
good.
now.
I'm so glad you were able to find a solution to that. And I'm sure that like as quarantine goes on and you get more experience with your website, that'll help you too.
Yeah, I think it's on the up, hopefully, but still nerve-wracking, the unknown.
That's cool. You get to stay home with your husband too.
Yeah.
So just a little bit more, do you ever find yourself like having to turn to like alcohol or any substances to find comfort?
No.
Okay.
I like a glass of wine here or there.
How often would you say you drink a glass of wine?
Well, since being in quarantine, maybe like one every night.
One every night.
Kind of like, what else is there to do?
Yeah. Just relax, end the night with a glass. Okay, and I'm just going to ask you a little bit more about your medical history and your social and family history, just to get an overall better picture of your health, okay?
Sounds good.
So in the past, have you ever been hospitalized for anything?
No.
Okay. And any hospitalizations, like, for example, like for any psychiatric illnesses or alcohol or substance abuse or anything like that?
No.
Okay. Have you ever had outpatient follow-up for any problems?
No.
Okay. And have you had any previous similar symptoms to anything you're currently experiencing now, like what you told me? I know you said the same, like, episodes haven't occurred in the past, but anything else, like, similar at all?
With the symptoms of, like, the heart and stuff, no. I mean, my mom used to say when I was younger, I was definitely more of, like, she would say I was an anxious child.
Okay.
I don't really remember that, but that's what she says. I was kind of always like the worrier, but I never had anything with like my heart or the breathing or anything like that.
Do you feel like you're more anxious than a normal person usually?
I wouldn't say so, but maybe, my mom would probably say I am.
Okay. I see. And do you have any other medical conditions that I should be aware of, like hypertension, which is high blood pressure, high cholesterol, diabetes, anything like that?
No, I had an anemia a few years ago. They put me on like iron for that. And I get migraines. That's it.
Okay. And are you still taking iron for the anemia?
No, they had me stop it like a few months ago. They said everything was fine.
Okay, that's wonderful. Okay. And have you had any surgeries in the past?
No.
What about any history of seizures?
No.
Any previous head injuries?
No.
Okay. And I know that you said you previously took iron. Do you currently take any other prescription medications?
Just a multivitamin, not prescribed though. No, that's it. I was on birth control for a while, but we stopped that obviously.
Are you currently using any like other resources to help you guys try to get a baby or have a baby?
No, I mean we've just been trying on our own. It's been really hard. I feel like all my friends are getting pregnant, and I'm the oldest. Out of my group of friends. So, yes, it's sad.
Yeah, it's okay. We're gonna try to get that all figured out for you. Okay, I'll put in a referral for that later. And on top of that, do you have any allergies?
No.
Okay, no allergies to medications, any foods,
no.
Any like substances like seasonal allergies or anything like that?
No, pretty good.
And I know that you said your mother had a history of depression for 5 years already. Are there any other psychiatric illnesses that run in your family?
Well, my sister, she's 4 years older. She had anorexia actually when she was in high school. Received treatment for that, and she's been fine.
She's doing better now?
Yeah, she's good now. Good. She's married. Living happily, I think.
Okay, that's good. What about any like alcoholism that runs in your family or any substance abuse?
My aunt on my mom's side actually is a recovering alcoholic.
How's she doing now?
She's good. She definitely, had her fair share of medical issues from it. They I don't know what exactly, but they said that her liver's bad and, things like that. But she's fine.
That's good. I'm glad she was treated for that too. And what about any history of suicide in your family?
No.
What about any history of violence in your family, like any domestic abuse or any other types of abuse?
No.
Did you feel safe growing up in your home?
I did.
You did?
Yeah.
And do you currently feel safe where you are now?
Yeah.
Okay, perfect. And just tell me a little bit more about yourself, about like where you were born, where you grew up, how school was like for you.
So I was born in Redlands, not too far from here. Born and raised there. My family's all still there. And school is fine. I always did well in it, didn't love it. I went to college, got a business degree, and then settled down here. Yeah.
That's awesome. And how would you say your relationship with your family was like growing up?
It was always good. It's kind of hard when my sister was having her issues, with food and stuff. That put a strain in the family.
I'm sure that's definitely.
But kind of grew apart. But we're really close now. I always try to like call and check in on her. But we all had good relationships.
That's good. And now they're like all living near you as well. So would you say you have like a good support system around you?
Yeah, definitely.
That's good to hear. Yeah. Okay. And you currently are married and you're trying to have children. And I assume you live with your husband?
Yeah.
Do you live with anyone else as well, like any other housemates or roommates?
No,
or
just me and my husband right now.
Okay. And what does your husband do for work?
He works in finance. He's a financial planner.
Oh, cool. And he's working from home as well. Yeah. Okay. And growing up, have you ever had any issues with the law?
No.
No? Any DUIs or anything like that in the past? Okay. And I know that you said you usually have like a glass of wine every other night or every night. And when did you like first start like just drinking alcohol in general?
Like ever? Probably when I got to college. My freshman year of college.
Pretty typical.
Experimenting, yeah.
Do you use any other substances, like any recreational drugs or anything like that?
Not currently. In college, I dabbled with, smoking weed just a few times.
Any currently?
No.
Okay.
Makes me too sleepy.
And then, do you currently use any cigarettes, or have you previously used in the past?
No.
So mostly just the wine every night?
Yeah.
And in regards to that, have you ever felt like you need to cut down on your drinking?
No.
No? Do you find that your drinking annoys other people, or you're annoyed at yourself for drinking?
No. My husband drinks every night with me, so that makes me feel better.
Oh, that's nice. Nice bonding time and relaxing time at night together. Do you ever feel guilty after you drink?
No.
And do you ever find yourself reaching for like a glass of wine or anything else in the morning if you have a hangover, or to get you through the day?
No. I reach for the aspirin.
Pedialyte is good too. And okay, so on top of that, I'm just going to ask you a little bit more about your overall general everyday health, okay? And these are just questions you can say yes or no to. So in general, do you feel like you get fevers on a daily basis or regular basis?
No.
Any chills? I know you said you don't really have much change in weight. What about any night sweats?
No.
No? Okay. Any decreased vision or blurry vision that you've noticed? Any eye pains?
No.
Any difficulty seeing?
No.
Okay. And what about any ear pain or ear drainage?
No.
No. Any decreased hearing that you've noticed? No. And what about any runny nose?
No.
Nasal congestion or stuffy nose? Any bleeding from your nose? Okay. And what about any sore throat?
No.
No. Any difficulty swallowing that you've noticed?
No.
And have you noticed any like swelling around your neck?
No.
No. Any neck pain? Any neck stiffness?
No.
No. Okay. And what about, I know that you said you have shortness of breath during your episodes, but have you noticed that any other time in your life?
No. No.
And any cough that you notice on a normal basis?
Mm-mm.
No. What about any chest pain besides during your episodes?
No, not that I've ever noticed.
Okay.
Yeah.
I know you said you also feel like your heart's racing during those
Yes.
times. What about on a normal basis? Do you ever feel that?
Mm-mm. I mean, maybe only like if I'm working out, but like
Yeah.
this, I feel like it's like trying to come out of my chest.
Okay, but nothing abnormal usually.
Mm-mm.
And do you ever feel like you have any burning when you urinate?
No.
Ever notice any blood in your urine or anything like that? Okay. And what about your abdomen? Do you ever feel like you have any unusual pains?
No.
Any nausea?
Not really.
Okay. Any constipation
No.
or diarrhea?
Mm-mm.
And then do you feel like you ever have any muscle aching that's abnormal to you?
No.
No? Any joint pains?
No.
Do you feel like you ever have like tingling or numbness on any part of your body?
No.
Have you noticed any rashes on your skin that's been abnormal for you
No.
regularly? No? Any lesions that you've noticed on your skin? Any bumps or masses? And then I know you said you didn't have any neck swelling, but have you noticed any enlargement of your lymph nodes anywhere else, like on your clavicles or anywhere, or in your armpits? Sounds good. And is there anything else you had any concerns with that you want to bring up?
No.
Okay. So during this time, I'd also be observing for my patient's appearance and behavior, and I'd already sort of get a general gist of like their speech and affect and mood and how they're going to be cooperating during this time. And I'd also be observing my patient's thought process and whether or not she's rambling or if she seems to have any unusual phobias or delusions or anything like that. And so I would next discuss my potential differentials with my patient, which would first be panic disorder. So based on what you've told me, it sounds like you may have something called a panic disorder when you get those random episodes of like terror and fear with the palpitations and the sweating that you feel. That's all part of this panic disorder that you may have. And I know it does come randomly at times. So that's one of the potential things that I may be diagnosing you with. And others would be maybe like anxiety as well. Although that's less likely because she's not feeling as anxious on a daily basis, although her mother does say that she was anxious growing up. And also, of course, I diagnose her or like I do further evaluation of why she's not able to get pregnant. So I would also be wary of like maybe she has like cysts or something else that's going on. And on top of that, everything else seems to be okay. So maybe she would also have like her mother has a history of depression, so I'd probably do a workup just to make sure that that isn't affecting her as well. Although based on her story, she seems to be less likely depressed. But yeah, those are my differentials.